On the show, we explore various alternative health therapies that are being used in place of and alongside conventional medicine. People worldwide are crediting the cannabis compound CBD for helping with everything from childhood seizures to cancer without causing you to get stoned. CBD can now be found in a variety of products, including oils, capsules, teas, and lotions. But while solid medical research surrounding CBD's health properties is still in its infancy, our next guest, Tracy, credits the treatment in part for saving the life of her daughter, Sophie.
So Sophie was born on October 3rd, 2012. She was perfect and was the picture of health until at 8.5 months old, we noticed that her left eye had begun to shake back and forth. And over the next couple of days, I saw that it continued to shake more and more. So we called her pediatrician immediately. And at 6 a.m., we showed up for an MRI. We went home, she was fine, we felt relieved, and the phone rang, and it was Sophie's pediatrician. He proceeded to tell me that they had found something on Sophie's MRI and that she had a brain tumor.
Any parent, you want your kid just to have a normal life. That's what we all ultimately want for our kids. And we weren't looking at that.
The challenge with these tumors is because they keep coming back and because they wrap around the optic nerves, a lot of kids go blind. The only option our child was offered by her oncologist was chemotherapy.
I felt so powerless. There was nothing I could do for my child, and chemo being the only option was, I don't know, it was pretty devastating to both of us.
So we started the chemo, and at first it was really, really brutal on her. The vomiting and the diarrhea, and her hair started falling out, and we just couldn't get it to stop. So through a chain of events on social media, I was put in touch with Ricky Lake and Abby Epstein, who had just started producing a film about using cannabis oil for pediatric cancer. After looking at the evidence that they brought forward, and after investigating it ourselves, and after speaking to Sophie's oncology team, we decided we wanted to try this. So we started her on a very low dose. We put it on her passy, and she would eat it. And we slowly would work it up, and we watched and waited over a 2.5-month period. They were just about to the point where they were gonna have to change her chemo protocol once we got that first scan, and that first scan was amazing. The combination of the cannabis oil and the chemotherapy together was quite exciting to not only us, but the doctors, because the tumor was shrinking. Sophie just turned 5 years old. Today, she's healthy, she's happy, she's thriving, she's still in treatment, but to meet her and to know her, you would never know that this child gets chemo pumped into her every other week.
When you go through things like this, you think a lot about the future. Just looking ahead to her graduating from high school and me being able to walk her down the aisle. And now that picture is so much more clear to me.
I don't know if it can cure cancer, but I 100% believe in it as a medicine for cancer.
Tracy and her husband Josh join us along with Sophie's Dr. Bonnie Goldstein. Thank you all so much for being with us. And obviously we're so happy that Sophie is doing well. And as parents, I want to ask you, because obviously you're passionate about this, what do you think life would be like for Sophie without this additional treatment, if you will?
I believe this oil has helped my child on so many levels. Not only has it helped preserve her vision, her neurologist told us she had a 100% chance of going blind, with minimal vision in the right eye being a best case scenario. We shrank that tumor by 85 to 90% that first 13 months, and the tumor was not supposed to shrink. And what we have seen from an immune response has been incredible. She suffered from 9 blood transfusions that first 13 months, and 4 months before she got off chemotherapy, she stopped needing blood transfusions. Her doctors actually came to us and said, unless there's something else that you're doing at home that we don't know about, we want to attribute this to the cannabis because this is medically impossible, and cannabis was the only thing we were doing.
Well, just to clarify for our viewers, and we're so glad she's doing so well, but you were doing the CBD oil alongside the chemotherapy, correct? It was really kind of meant to make it much more tolerable so that the chemo could do its work, improve her quality of life, and allow both to do their job together, correct?
We 100% believe in the synergy of Western medicine and cannabis oil. This is not, we would never go against our doctors and take our child away from their care or remove those chemotherapies, because we just don't have enough science yet to tell us how this medicine needs to be administered perfectly.
And I think you are a wonderful advocate as a parent to use the word science. Dr. Goldstein, I want to ask you the role of cannabinoid oils, not only in Sophie's treatment, but obviously the expanding possibilities with it.
Well, in Sophie's case, it was an add-on. But in my practice, where I take care of a lot of children, I have a lot of patients that come to me where nothing else is working. And we've had a handful of cases where cannabis by itself has actually put children into remission. But the scary thing is we don't know what dose, we don't know how long they have to take it for, we don't know what combination of cannabis oils they need to take. And so without the research that we need, and again, everybody should know that right now, cannabis, despite being legal in California and in other states, it's still federally illegal because it's on a Schedule I controlled act. And unfortunately, we're not allowed to do the research that we need.
Continue our conversation about the product CBD. CBD advocates Tracy Ryan and Dr. Bonnie Goldstein join us now alongside Daniel Fabricant, the former FDA supplement director and president of the Natural Products Association, because in the previous segment we talked about the need for more research. Daniel, I want to bring you into the conversation because there have been a lot of claims made without the science to back it up. So the FDA has jumped in and said, wait a minute, you can't say things like this will cure cancer or these other claims where there's no great science on it. So where do you stand on this?
Well, you can't make claims on anything calling itself a dietary supplement to cure, treat, or mitigate a disease. Dietary supplements don't treat, mitigate, cure disease, especially things, cancer, Alzheimer's, what have you. So that's first and foremost. You do have, if you're looking to treat diseases, there's a process for that. And there are companies actually going through that process with CBDs right now.
Given that there's a place for CBD oil, but I guess you have to be careful as a consumer because not all CBD products, oils are being sold, put together in the same fashion with same concentrations.
That's right. That's exactly right. That's why it has to be studied. And you heard that in the last part of the segment is you've got to get the dosage for women, men, children. Who is it for? What's it for? And making sure that's studied appropriately so there's a balance between risk and benefit.
So I want to ask Dr. Goldstein, you are someone who is treating patients using cannabinoid oils. When you source these, how do you go about doing that in a way where, even though in some ways you still don't have the perfect protocols, how do you at least know the product is safe and what parents and you are paying for?
What I tell people is, don't get anything if you don't know what it is. Good, responsible companies that provide excellent oil, the oils that my patients are getting better on, have test results on their websites. They have test results available. If I were to call a company and say, you know, a patient got oil from you, can you send me the test results? If I don't have that in my inbox and my email, it's a deal breaker.
So is that the biggest red flag, if the company's not willing to give you the test results?
That's exactly right. Everything should be tested, it should be transparent, and they should be excited to share that with you, to show you exactly that their oils are exactly what they say it is. And if I could just add in, what I've seen, I know it's science, I know these compounds and the way they work in the brain, because that science has actually been established. But the reality is that it can look like a miracle when you've been struggling with a child who's been sick for years and years and years. It looks like a miracle when your child is finally well.
And I want to address parents right now because, Tracy, I'm sure that you and Ryan are here representing a lot of parents out there whose kids have struggled. The reason that this is such a hot button issue is because when you hear kids and cannabis, it's a scary association. Just to clarify for everyone watching, CBD is very different than THC, which is the component of marijuana that people consider to give them the high. We are believers that in certain individuals, even without great science, this has really changed the lives of countless children. But I'm assuming that you two also have observed the hurdles out there because it's a hot button issue. Again, you're hearing weed and kids.
Right.
Is that proving to be a hurdle for you all in your desire to advance this treatment?
It hasn't for us personally, and I'll tell you why. Because if you actually look at why cannabis is illegal in the first place, you'll find that it's all based on stigma and power and money. It had nothing to do with it being dangerous. In 3,000 years of using this medicine, no one has ever died from cannabis overdose.
The effect of cannabis on the brain of a developing child, there's some concerning studies out there with that.
There's also
so you got to be a little careful there.
Of course. You want to jump?
Yeah.
People overdose on water. People can overdose on anything. It's the dose that makes something helpful or harmful. So the notion that it's because it's natural, it's perfectly safe.
No one out there wants kids recreationally using marijuana because of the potential effects on brain development. How do you bridge that gap between kids who need it medically versus the kids who are out there hearing it's fine, it's benign, no problem, I don't have to worry about using the substance, it's not going to cause me any issues?
Well, one thing that we have to understand is really how is it working in the brain. What we're finding is that there are diseases that the root cause is there's an imbalance in that system that is supposed to keep you in balance. And so those are the patients that we're trying to target. In a healthy teenager, I'm the mom of a 17-year-old boy. I started teaching him when he was 8 years old that he is healthy and that by taking any substances, during the time of development, which really adolescence is a very vulnerable time when you're taking things that you shouldn't be taking, you can throw off that endocannabinoid system, that system that's keeping you in balance. You throw that off, you can create problems. But we remember the patients that we're treating is in pediatric age group are children that already have had diagnoses, they've tried usually conventional medicine. I really don't have any patients that haven't gone through the conventional medicine program. And oftentimes this is just an add-on. For some people, it is the only thing that will help them.
Let me say this. Everything Dr. Goldstein you have said, I support. What I would caution a parent out there from doing is if you have a child who maybe has a medical issue, and it could even be cancer, you don't want to go see a practitioner who is shooting from the hip, because that is a grave possibility here until there is more data. And I'm assuming, Tracy and Ryan, you've put a lot of trust in this process. It's worked for you. Before we go, Dr. Goldstein, how do I know that I'm seeing a doctor who truly knows what they're doing with regard to adding CBD as a treatment?
Well, unfortunately, because of the stigma and the fear, a lot of doctors are not interested in doing this. There's not very many of doctors, especially a pediatrician, who's doing this. So I've encouraged a lot of doctors. They're more than welcome to come and sit in my practice so they can see what I do and learn from me. I've been doing this 9 years now, and I'm definitely seeing more, I'm getting more referrals from mainstream doctors, from specialists, because they're starting to hear from their patients this is helping. And of course, nobody wants to harm a child. I mean, we take an oath, do no harm. But in my experience, this has absolutely been one of the safest substances I've ever recommended to a
Pediatric Association opening up their minds? Is this something that they're adding to their programs, the big meetings to discuss it and
They absolutely
make
are.
pediatricians aware?
Yeah, I got a CME magazine, and the cover was medical cannabis, myth versus truth. And that's great. Let's put it out there. If this is a root cause of illness, how are we not learning about this in medical school and residency? So we need to start incorporating that, because we can help a lot of people with this. I tell everybody, you know, I was trained well, and I try to walk that middle line, but there's no denying that many of my patients have had life-changing and prognosis-changing with cannabis oil.
Times are changing.
May I ask a quick question both to Daniel and to you, Dr. Goldstein? So given that these are still supplements and there's no actual FDA-approved drug, and there is so much variability in terms of what you're actually getting in these products on the market, how do you ensure, if this is something you're considering, that you're actually getting a safe, tested, reasonable product that is appropriately labeled?
They shouldn't be available as supplements, especially for the types of scenarios the doctor's talking about here. You're talking about treating for cancer. That's not a supplement. So if anyone's looking for cancer treatment in a supplement, don't. Shouldn't be there at all.
I want to applaud you for saying that. It's very important that people don't start searching out this magic bullet supplement. But I applaud the two of you for advocating for your child, and we're so glad that Sophie's doing well. And
continue your mission.
Dr. Goldstein, Daniel, thanks for being with us. Times are changing. If you think about it, when we went to medical school, we also didn't learn about nutrition. Now there's widespread knowledge out there that nutrition affects outcomes. In the next decade, probably you're going to see more medical doctors being trained in the use of cannabinoids,
it's approved in 29 states already for medical use. So that
things are changing.
Changed, yeah.
And certainly scintillating conversation. We'll have more resources on our website, thedoctorstv.com.